Good morning, everyone. My name is Scott Morishige. I'm the Governor's Coordinator on Homelessness, and I'll be facilitating today's session. I'm also assisted today by Emma Grahusky from my office, our Community Development Specialist, and she'll be helping to manage our PowerPoint presentation and advance the slides for us today. The focus of this panel is regarding coordination of efforts to assist individuals experiencing homelessness, really to make connections to stable housing, especially for individuals who are in unsheltered situations on state lands. So we'll provide just a brief background regarding current context of homelessness in Hawaii, highlight a few case studies that kind of illustrate how state agencies are working to connect the individuals we encounter to services, and how we're also coordinating to just increase the capacity of our state agencies across the board, including law enforcement and land management, to be able to better assist homeless individuals. So I wanted to start by introducing myself as well as our other panelists. So starting with myself, just to give some background, I've had the privilege of serving in this role as the homeless coordinator for Governor Ige for the past 5.5 years now. I can't believe it's been that long. My role is to influence policy at the state level and to partner and coordinate efforts with other state departments, as well as the 4 counties and our service providers. And I'm also a social worker with my master's in social work from UH Manoa, and I really try to bring that experience into my work in this role. And I'm very honored to be joined today by colleagues from both the state and our nonprofit sector. So I'll start off with Jun Yang. So Jun is the Hawaii Department of Transportation's homeless coordinator, and he previously served as the executive director for the Mayor's Office of Housing at the City and County of Honolulu, and worked for several years as a community organizer both in Honolulu and Los Angeles. So Jun really brings compassion to his work and also has great insights about how to address housing and homeless policy on a systems level. Our next panelist, Pua Aiu, is a Special Projects and Cultural Resources Manager for the Hawaii Department of Land and Natural Resources. And Pua has been tasked by the chair of DLNR, Chair Case, to coordinate issues related to homelessness internally in the department. And both Jun and I work very, very closely with her. And her job, and Jun's job, is not just a desk job. And it's really not unusual to see both of them working out in the field. So they'll share a little bit about that later on in the presentation. And finally, our last panelist is Heather Lusk, Executive Director of the Hawaii Health and Harm Reduction Center, which is the outcome of a merger between the Life Foundation and the CHOW Project. Heather is the co-director of HEP Free Hawaii, and currently serves as the Vice Chair of Partners in Care, our continuum of care for Oahu, and she'll actually soon to be the new Chair of Partners in Care starting in January. So I've really found Heather to be both a collaborative and innovative leader, and her organization has really been a key partner to the state in coordinating for services for the individuals that we encounter. So if we can move on to the next slide. I'll just start by giving a quick overview on the context of homelessness here in Hawaii, what we can potentially expect in the next few years. So this chart you see in front of you, it really shows the point in time count numbers of individuals experiencing homelessness in our community over the past 15 years. And a key thing to point out here is the impact that we saw on homelessness after the last economic recession in 2008, 2009. So as you can see, there was a gradual increase in homelessness, about 37% increase, almost 2,000 additional people experiencing homelessness between 2009 and 2016. I highlight this because we know that we can expect a similar increase on a much larger scale as a result of the current economic challenges that our state is facing due to the pandemic. And similar to the last increase in homelessness that we saw following the 2009 recession, it's likely not just to be a 1 year or a one-time spike in homelessness. And the increase in homelessness is likely to occur over a gradual period of time. And in particular, we can expect to see increases in the population reflected in the green bar, which is persons experiencing unsheltered homelessness. So those are the individuals we're most likely to encounter on state lands or in city lands. So I know that this outlook sounds pretty grim, but I think there are some bright spots in looking at the past trends and the data. So from looking at the past, we also know that homelessness has been decreasing overall by 18% over the past 4 years, between 2016 and January 2020. And that downward trend occurred primarily because we had increases in housing focus programs like Housing First and rapid rehousing, like the mayor talked about this morning, as well as really increased coordination among all partners, both in government and in the nonprofit sector, as well as community volunteers. So if we can figure out how to maintain and increase coordination, as well as bring some of our housing programs to scale, I think the bright spot is that it really is possible for us to mitigate the rates of increase in homelessness moving forward and to bring those numbers down again. So if we can go to the next slide, please, Emma. So this is a map of our homelessness system, our system of homeless services as it exists right now. And this is just to give you an idea of the type of system that we're operating. So in general, the system flow starts with outreach and engagement, focuses on triaging homeless individuals to a service pathway that connects them to housing. And this pathway could include a stay in shelter, but it also can include, and we see this often, actually referrals directly from the street into housing placements or into other stable placements. The system flow also includes a variety of different options for housing, so it's not just one type. And this variety includes a range of permanent supportive housing programs, rapid rehousing, as well as mainstream housing options. And the main thing to take away from this chart is that our homeless system is not one size fits all. And it's really important for us to have a wide range of different options in our system for the different circumstances that homeless individuals are experiencing, because there is really broad variety in that. And the other key thing to note is where we on this panel fit into the systems map. And primarily a lot of work that we do with individuals we encounter in state lands is on the far left-hand side of the panel. So we're often the step right before outreach. And a lot of the work that we do is helping to do the warm handoff and the initial connection to an outreach worker to offer services to individuals. So that's just a brief overview so you have some context of where we're starting from. So next, I'll hand things over to Pua, and she can talk about the state's role in addressing encampments on state lands and also share the first of 3 case studies that we'll present to you today. So Pua.
Thank you, Scott. So I have an echo. The issue for the Department of Land and Natural Resources is that when we encounter homeless on our lands, and we have a lot of homeless on our lands, we have serious management issues because we're supposed to manage our lands to meet the mission of public enjoyment and preservation. So these are some examples. The first one is at our harbors. That's a large encampment that we recently cleared out. And the problem with management at the harbors is that people have been breaking into the bathrooms. There is some crime at the harbors, and it diverts funding which could go to improving the harbors to the management of homeless. And so the first 2 pictures actually are the harbors. This third picture is Hamakua Marsh, which is a wildlife sanctuary. That's a closed area because it's a protected area for endangered birds and also different kinds of plants that those birds or butterflies feed on. And so when we have homeless in those areas, there is a lot of trash there, and which could be endangering our animals, and as well as there's no sanitation. So again, those management areas. The picture of the fire is Diamond Head. And so obviously fire is a management issue. Diamond Head is also a closed area where no one should be, and we have about 23 campsites on the slopes of Diamond Head. And again, there's some criminal activity there. We get a lot of complaints about Diamond Head. And so and as for those of you who were tuning in earlier, it's one of our more challenging areas to do a cleanup in because it is steep and requires some physical abilities. But the homeless population there is very resistant. On all of these places, whenever we do a cleanup, we do work with the outreach workers, because we found that even though the outreach workers sometimes don't want to work with us, it's always really good for us to work with the outreach workers because we can connect them up to services if they haven't been already. And if we have dialogue with outreach workers, we can ensure that what the homeless people are telling us and where they are in their progression for, say, documents or ID, that we're all aligned on in the same place, and we all know what the story about that person is. The last picture at the bottom is a great example of collaboration. This is a homeless encampment under the Nu'uanu Stream Bridge, and it's literally right under the bridge. And in order to clear this one out, we had to coordinate with DOT, or DOT had to coordinate with us because our dog care officers have boats. And so it's really important for the state agencies to bring all of the different pieces together. We'll be talking about training and the help that Heather gives us also, because everybody has a little piece of the puzzle, but none of us have all the pieces. So coordination and working together is really important for all of this. Emma, can I have the next slide? So our first case study is a person at Diamond Head with severe mental illness. As the slide says, single female, and she had case management for quite a while, and the case managers were trying to get her connected to a doctor so that we could get her a mental health diagnosis, so that she could tap into a lot of the additional case management and services that comes with a mental health diagnosis. But she would not go to the doctor. She wouldn't go to a clinic because she has phobias of people and being in buildings and various reasons why she couldn't get there. She couldn't take her dog, and the dog wouldn't be allowed in to the building. So finally, there are some really good things about COVID, one of which is that many people have had to go to telework and telecommuting and telemedicine. So the other issue with some of our people is that they're hard to find. And so we were trying to get in, the case manager at CARES was trying to get in touch with her. And finally they called me and said, we can't find her. So I said, okay, I will meet you and I will take you there to meet up with her. So this was about 6 o'clock on a Friday, and we met up, we found her, and the case manager who was there was able to hook up with a doctor at that time via his iPad, and they did a diagnosis, and she got a diagnosis within about half an hour. So that worked out really well because we didn't have to take her into the clinic, which wasn't happening for at least 6 months. Once she got the diagnosis, she was able to get elevated case management, and we were able to get her accepted into shelters. Unfortunately, she declined multiple offers of shelter over time, even though the case managers took her to the shelter, they dropped her off at the shelter, but she kept leaving. So after a certain point, there wasn't much we could do to stabilize her. But we still keep in touch with the case managers and I give them periodic reports on how she is. But unfortunately, she's not ready to move. And believe me, if any of you have seen the slopes of Diamond Head where the homeless live, you might choose to live there as well. I'm going to hand off to Jun now.
Hello, I think I'm unmuted now. Hi, my name is Jun Yang. As Scott has introduced us, my name is Jun. I'm the homeless coordinator for Department of Transportation. The position, this is a unique position in Department of Transportation, not something that you'd think of naturally for a homeless coordinator. About 2016, 2017, the department started to think about how can we maintain and keep our right-of-ways a little bit more safe, with the idea of just making sure that it's accessible for pedestrian and vehicle traffic, what these roads and right-of-ways were meant for, designed for. And in 2017, we started a contract with the contractor that we're working with right now. And then I joined on in September. So been with the position a little bit over 3 years. The idea behind it, the reason why the department had thought about me possibly for this position was mainly because of some of the history of I've had working on homeless issues within the community, and some of the just the knowledge of the different programs. And so the unique part of it is, as Pua does as well, very well for DLNR, is the tie into services and service providers and different organizations, and working closely with Scott Morishige's office. The areas I work with initially started off with just Department of Transportation right-of-ways, but then with the wisdom from his office, we were able to open, Scott's office, we were able to open up kind of our contract to work within a lot of our other state departments as well. That's where we get to coordinate together with Department of Land and Natural Resources, Hawaiian Homelands, Department of Education, like in the high school and school areas, and Department of Ag. So just really some quick dates. I started 2017, September, and then a month later, challenged with looking at the Nimitz Viaduct, which for many, many years had been a very large encampment. We've had, I think it was 120 or 100 plus people living and kind of in the area, encamped. My responsibility was to kind of clear and coordinate that. Scott and Pua both came out, and a number of our service providers, many of you, if you're here from the organizations, came out and provided service. And we actually found 40 some odd dogs and plus, and some, I think, hamsters or some other kind of animals as well. We moved from that to all departments and then statewide not too long after. And so I've been flying back and forth between all of our districts across the state and working with all of our department representatives on each of those states as well. Going to the case study, the second case study today really is a part kind of related to the Nimitz Viaduct. That's part of the reason why I brought it up. After the October beginning cleanup in 2017, many of the individuals moved, some moved to shelter, some moved across different places with family, and some moved to different areas. And so other areas included the Nimitz bike path from Kehi Transfer Station all the way down to Valkenburg, just along that strip. And so along the area which we call Ponchos, which is on Kilihau and Kokoi, we have a number of encampments that are there. One of the individuals that we encountered is, I'm going to change the names here, but I'm going to call her Mihan, because I'm Korean, it's just easy with Korean names. So Mihan, I encountered her for a long time, and every opportunity, letting her know, hey, there's services for you, shelter if you want it. Very, very resistant to all of the interactions, but also letting her know that, hey, you cannot have your encampment under here. It's not safe. It's not suitable for housing in any way. You have to move your items away from underneath the freeway. And so we've been doing this for a couple of years. There's a lot of underlying health issues, some substance abuse as well. And she has an adult daughter, and we're going to call her Suyong today. And Suyong, we've been encountering her around different places, but Suyong, she's younger in her 20s, and has just recently, in the past year, gave birth to a baby boy. We're going to call him Cholsu. Now, around June, through our cleanups in the area, Mihan had been coming, and every time I came to the area, which was about once a week, twice a week, she would come in and approach me and just approach my car or wherever I'm standing, walk over to me and say, June, hey, you know, I need something. I need to get out of the area. Can you help me? So took her information down a number of times and forwarded it to our agencies through Scott and hoping to get people to see if we can find a fit for her, shelter or whatever it might be. But what really helped was her daughter, who had recently moved back into the area, kind of in a neighboring location, was gone one day when we were clearing. So, and her mom said, hey, I'm fed up. I'm not going to deal with her belongings. You store them. So we stored all her belongings. And after about an hour, Suyong arrived with her son Chosu. At this point was about 7 months old or so. And what really got me was Chosu. He just, in her arms, just eating McDonald's French fries, and that's the part that really got me, mainly because he's about 6 months old, and raising a daughter, we want to make sure that they're eating healthy, and he's just eating some salty McDonald's French fries, and he just got me to a point where, like, hey, Suyong, isn't there something else that you want here? Isn't there something else that we could do, and kind of, because this is not a safe place for you, but especially not for your child. And she just told me, all I want is the playpen for him to be able to sleep on. And I told her, I can get the playpen for you. That's not a problem, but can we really work on, housing or shelter, some other option? Because you have to think about, what about your son? What about Chosu here? And her auntie, Suyong's auntie, was standing next to her and just kind of gave her a prod and said, hey, why don't you think about it? And so they told me, can you come by tomorrow? And so I did. And working with Scott, we were able to find a shelter that would take her the next couple of days. They were able to, and at that point, Mihan said, hey, I'm going to go with them. And the three of them went into the shelter together. And within a short amount of time, Mihan was able to stabilize, and within a few months is now in housing, in her own unit. And I'd always kind of talk with her, just kind of, hey, Mian, don't you want to just be able to sit down and watch some TV and not see me? Wouldn't it be great to just close the door and not worry about if June and HTM are going to come by and store your things? So can we work on something positive for you? And so now she's in her own unit. I hear that she's enjoying that unit so much because it has air conditioning, which she never had at the Nimitz Viaduct area. Now, Suyong, she's with Chosu and her boyfriend, and they're in transitional housing, working towards the next step. And that's really exciting for me to hear. I'm not getting report backs directly from them, but it's just great to hear that the next step is happening and that our system is able to respond in this way. The frustrating part for me sometimes was, as we're trying to find a right fit, some of these doors were not available and open at those times. But in this case, 3 months ago, in July of this year, that opportunity was opened, and we were able to help mother and adult daughter and child move outside of a place that's very, very unsafe. Lots of violence, dogs off of leash, and just into a very safe place for the child to get the services that the child needs for healthy growth, and for Suyong to be able to work together with her boyfriend on next steps on how do we then work on saving up for your own place, and those are the next steps that I hear they're working on right now. I'm excited about this, and I'm excited to continue to be able to work with our service provider organizations. We have a number of these success stories, and they really help me continue to do the work that I do and work together with Scott and Pua. So yeah, we're going to continue doing this, and we're going to continue working with everybody around the table. And if there's any other things that we can do, please let us know. And I think that's about my time. Thank you.
So we'll move to Heather next for our case study. Heather.
Thank you, Scott. Aloha, everybody. As Scott said, my name is Heather Lusk, and I am blessed to be the Executive Director of the Hawaii Health and Harm Reduction Center. Our mission is to reduce harm, promote health, create wellness, and fight stigma in Hawaii and the Pacific. We really work at the intersection of houselessness, substance use, mental health, the criminal justice system, and chronic diseases like HIV. I've been really honored for me and my team, particularly my law enforcement assisted diversion or lead team, working with Pua, Jun, Scott, and all of our state partners. Pua said it well to say that, we need to work in coordination. And what we found is that many folks, especially compassionate folks like Pua and Jun, often would have these relationships. I mean, you heard how much Jun helped this one family, and that's not unique. Both Pua and Jun, Scott, and others doing this work on state lands really built relationships with folks that we found as service providers often helped us do our jobs better. So I'm going to talk a bit about one of our law enforcement assisted diversion participants who's still active with us that was identified, I believe, through the sheriff's work and getting them into services. So as you see here, he was single male, late 50s. He had been chronically houseless, probably more than 10 years, and had no identification documents. I don't remember how many touches he had with the sheriff, Scott, but it was quite a few. And so part of law enforcement assisted diversion, and I think Scott can put a link to our evaluation in the report in the chat, if you don't mind, Scott. We just released our second year evaluation on the effectiveness, and I'll share a bit about that in a moment, but it was through this process that the sheriffs identified John, as I'll call him, as somebody who could benefit from more intensive case management, which is the major function of lead. So one of my team went out and started to build a relationship with John. And as you can imagine, someone like John who's been on the street for 10 years, he's had some touches from other folks, but for whatever reason, it hadn't resulted in any significant movement. And so it took a while to build that rapport, but over time of touches from 1 to 2 a week, John was able to really build some strong relationships with my team. And the most important thing, as many of you know, is getting someone document ready or ready to get onto the by name list if we're to get them into housing. So John had been born in one of our U.S. Pacific jurisdictions, so affiliated with the United States, but not a state. And it took a full year with active participation from lawyers and our lead team to get the birth certificate for John. And during that time, as you can imagine, it was intense just to keep the rapport building, but just 1 to 2 times a week, keeping those talks. He got a phone through law enforcement assisted diversion, and which was really important because that allowed him to meet the requirements of his probation. As many of you know, many of the folks out there for especially to 10 years, and then especially during this year of waiting to get the birth certificate to get him document ready, his continued touches with law enforcement sometimes resulted in citations, or that resulted in a bench warrant that resulted in probation. So one of the successes, though, is he's now off of probation. He cleared it and met all those requirements because we were blessed to have flexible funding with LEAD to provide him a phone. And that allowed him to, again, connect with us as other service providers. We were able to get him connected with his primary care provider. He also has a chronic diabetes and a lot had already lost, I believe, 3 toes, getting him reconnected to services. He now is in permanent supportive housing about 3 to 4 weeks after we got the birth certificate. He got into permanent housing. Like many of our folks that have been on the streets a long time, it's not all, rainbows and roses once you move in. Yes, it's wonderful to have, electricity in pieces. At the same time, John had been on the street a long time and had survived with his family out there. And as many of you know, people take care of each other on the street. And so when he moved into his housing, many of the folks that had been in his community expected to be able to go along with him. And so we know that it's a continuing challenge to help our folks transition into a home, stay there, and not bring all of their street family with them, because that oftentimes breaks the lease or has other unintended consequences. So he is currently housed, though I will be honest, because of some of his visitors, probably COVID has been the main reason he has not been evicted. So we're looking to ensure to get him another placement in case that does happen. But continuing to work with him, I know we still hear from the sheriffs that sometimes he goes and hangs out again with his street family or friends, and understanding that that's to be expected. And how can we and my staff continue to support him? So for example, we have a life skills class that is offered to him and others about what does it mean to live in an apartment and have some of the, be able to adhere to the lease and other pieces. Because of his reconnection to primary care, we saw a significant reduction in his emergency room home visits. So it's again getting to those next levels of care for John now that he's housed. And we could never have done this without the collaboration with the Scott's office and the sheriffs to, one, first identify him, but two, then continue to help us find him when we would lose track of him during that year when we were trying to get him that birth certificate. The last thing I wanted to share about the kind of the miracle of committing long-term to working with folks like this is that John actually was able to have his estranged son come and visit him, who does not live in the islands. This was before COVID, and allowed him to come and have a place to stay and reunify. And that has really helped John and his own mental health and well-being. So John is still part of LEAD. As I mentioned, it's not over yet. The team is still continuing to support him and adjusting to his new sheltered life and how to keep that, as well as to deal with his other issues. One thing I didn't mention is that this is someone who uses methamphetamine, and while there hasn't been formal treatment, his methamphetamine use has gone down just because of the relationship building with the case managers and outreach, being housed and having access to these other services. So and lastly, food security. That's the other big thing that housing John has done, has allowed. He had some real inconsistencies with food access, and now comes into our clinic to get wound care and food. So, and our next step is to try to get him as comfortable going to his PCP as he does coming to us. So, as I mentioned, we know that this work never ends. So a bit about law enforcement assisted diversion, if you're not familiar. We just finished our second year. And again, that evaluation, I believe, is in the chat. Thanks, Scott. And the whole thought is that it's out of a Seattle best practice, where the thought is that if we can divert people from the criminal justice system, especially people like John that have behavioral health issues, and most of John's touch with law enforcement was around nuisance violations and really being not being on the street, that we're able to be able to support that person in getting whatever it is that they need. The other amazing thing about LEAD is that it's a very flexible intervention. So I know many of you that are here today are maybe funded through housing or homelessness dollars, or maybe you're funded through substance use or mental health. But oftentimes, that's the issue that we're allowed to address. We can maybe touch the other health issues, but we're really there to say, for example, if we're housing funded, do you want to go to shelter? Well, John said, no, I don't want to go to shelter. And then unfortunately, for many outreach workers, they're not allowed to do much else. And so what's unique about LEAD, again, is that whatever John needed, he was able to get. And an example of that was he was able to get a phone and be able to reach and connect with his son, his probation office, his PCP. And had we not had flexible funding, I don't know that we could have gotten John a phone. So LEAD found a 55% reduction in citations its first year. We had a little bit of an increase in citations our second year, but also had a 56% reduction in emergency room utilization. And as I mentioned, a 23% reduction in methamphetamine use of all of our LEAD participants, even though that wasn't the major area that we were focusing. So I'm so grateful for the opportunity to collaborate with folks like Jun, the Department of Transportation, DLNR, and the sheriffs, because it's really allowed us, again, to go deeper and coordinate care, because not just with John, but with other folks, if we couldn't find them, often we would hear from Jun, Pua, or the sheriffs or Scott, hey, this person has been on the radar on this state lands, and helps my team reconnect with them. So I'm really hopeful that this person will continue to thrive, and that we will prevent this person from falling into homelessness, even if John is evicted, and that we continue as a community to really help, especially those that have been chronically houseless. How do we help them transition to this very new reality of being in this apartment and maybe not having some of the autonomy, especially around guests and things like that, to still be able to stay housed and help them not feel isolated? Because as you know, many of our folks that go into housing often feel isolated, especially if they're housed not in the community or neighborhood that they were hanging out in. So this whole idea of addressing isolation and getting their needs met while retaining housing, I think, is the big challenge for those of us doing Housing First and other permanent supported programs. So one way, next slide, Emma, that we as a community have been doing this has been through efforts in training. I'm really blessed. I'm a social worker like Scott, but I also have a background, a degree in criminal justice. So I have always believed in public health, public safety partnerships. And I think Pua and Jun really exemplify that really well. So even before some of these efforts with the cases that we mentioned, Scott and his office were doing trainings. They had looped in me, IHS, Kalihi Palama, and other folks through Help Honolulu, doing trainings with law enforcement. And here's an example of me doing a training with DLNR and PUA staff, because as she mentioned, many of these folks, when they signed up to be doe care or work in our DLNR, same thing with DOT, they didn't expect that they would end up needing to be a housing outreach or homeless outreach expert. So having folks like me or my team, folks like Dr. Koyanagi or other folks that do street work come in and share, this is how we connect with folks. This is how some lessons learned and how we build rapport. This is what we see as important and how we can then again provide resources and be that linkage, because as you heard, many times these state folks have a better relationship or know these folks really well, and it just takes that that warm handoff to an agency to really kind of wrap them around those services. So in addition to doing kind of that homelessness 101, most recently we were really excited in collaboration with the Department of Health, the Adult Mental Health Division, the Hawaii Health and Harm Reduction Center, and NAMI, Kumi McDonald there, we were able to do a virtual CIT or crisis intervention training for many of our state law enforcement. So many folks may know that Honolulu, Maui, and hopefully soon Hawaii Island and Kauai participate in what's called Crisis Intervention Team or CIT training, which really allows or empowers law enforcement folks to get more de-escalation skills and be able to approach a scene or a situation with some of these communication skills to hopefully de-escalate a situation so that it doesn't result in a citation or arrest. And the evidence has been really strong for CIT, and we were so grateful for the opportunity to modify CIT in the age of COVID to a virtual setting. So we did 4 trainings of 8 hours apiece and trained over 100 law enforcement folks, whether it was doe care, sheriffs, narcotics enforcement. I believe we had some of Jun's folks as well come on and really be able to learn from other law enforcement professionals how they have done communication, mental health 101. We had a peer panel of people with mental health challenges and people that were formerly houseless to be able to share their experiences. So I'm really grateful that the state was so supportive, and you'll hear a lot more about CIT. It's something that's going to be continuing to build statewide, especially as it links in with the Department of Health's expanded mental health emergency worker program, where law enforcement statewide will have more access to psychologists on call to be able to get support as they triage these and hopefully de-escalate these situations. And that links to that last point that, as many of you know, Deputy Director of Health Mercereau and Lieutenant Governor Green had a task force in the past year that was looking at redoing a lot of our MH1 involuntary treatments statute and rules, and you're going to be seeing some changes over this year and probably also in the legislature that then allows a more active role for our law enforcement partners to, one, hopefully, build the skills that we don't get to MH1s, but when we do, that they have what they need to be safe and to support our mental health continuum of care. So again, really grateful to be able to share some of our experience as a community partner today. I really encourage those of you that are our community partners to potentially partner with DLNR or DOT or the sheriffs if you haven't already. As you can tell, these are folks that really have the best intent for those folks that are houseless and can really help provide that warm handoff. So thank you again for the opportunity today, and I'll turn it back over to Scott.
Thanks, Heather. And I think one thing to keep in mind is the efforts that we're talking about are not just efforts that DLNR, DOT, my office, or our service providers take on just by ourselves. It's really working as part of our larger system that includes many of you who are actually in attendance today. So I know that we have partners from Department of Health, including Deputy Director Mercereau in attendance, as well as folks from the city, Deputy Director Becky Soon from Department of Community Services, Tim Ho, and others, our partners from HUD. And it takes all of us collectively working together because none of us can do this work alone. So I really wanted to acknowledge everybody else that's in attendance today, because all of you, whether you're from a health plan or provider, so on, it's part of this collective effort. I did want to talk about one aspect of addressing people in encampments that we haven't touched on yet. And so Emma, if we can go to the next slide. And this is really addressing animals or pets that we encounter on state lands. And this is something that we encounter more often than not. And oftentimes, it's not just individuals with one animal or two animals. In some cases, I think with the Nimitz Viaduct operation that Jun mentioned previously, there was an individual with over 60 dogs at one point. And I think if it were not for the partnership of, the organizations mentioned on the screen here, and I know we have Susie Tam from Hawaiian Humane Society in the audience, without the help of your organization and others, we would not have been able to address the needs of both the people and their animals and be able to get those animals safely rehomed. I think the role of the animal service agencies is really critical, not only in helping those experiencing houselessness to properly care for their animals, to address any challenges they're having in getting access to care or access even to pet food and other resources, but also, if the individual has to make a transition to housing, and unfortunately the housing unit will not allow pets to come with them or will not allow a certain number of pets, we can work with our partners at Canine Kokua, Humane Society, and others to rehome these animals. I think another thing is when animals are abandoned in encampments. So the photos here are of 3 animals that were left behind at a campsite that DLNR recently encountered. And, Pua knew who the owner was, so she reached out to them. They had said, oh, we're not able to take the animals with us. Can you help them find another situation? Can you assist them for us? So we were able to call, in this case, Canine Kokua. They were able to actually respond right away, I think within a couple of hours. And, we kept in touch with them and they were able to share with Pua that, the white dog featured was actually missing from its original owner. So it was able to be reconnected with its owner. The 2 small Chihuahua mixes are in the process of getting rehomed to another placement. And there's also a kitten, I think, encountered from the encampment that's with another animal organization and getting assistance there. And so I think this is another part of coordination. So as I mentioned earlier, it takes many partners. So it's not just who you think of as a traditional service provider. And the state's approach is we realize that there are so many barriers facing some of the individuals that we encounter that we need to bring all the different partners together to be able to truly address these barriers. So I just wanted to kind of touch on this and share for those who might not be familiar with some of these resources. And Susie from Hawaiian Humane Society is going to be on a panel actually coming up in the next hour block talking about addressing barriers to housing for pet owners. So for those of you who are interested in that, please, I'd encourage you to participate in her panel. And I think it'll also feature Gracie from Partners in Care and their landlord engagement program as well. So Emma, can you go to the next slide? Okay. So that concludes the formal part of our presentation. I did want to share contact information for my office for those of you who are interested in learning more or want to get additional resources. You can reach us by phone, 586-0193, by email at gov.homelessness@hawaii.gov, or through our website, homelessness.hawaii.gov. We have information such as a LEAD evaluation report on there. We have a whole page highlighting how programs like LEAD work. We also feature information about other types of homeless resources. on there. So just wanted to share this information with you as well as a resource. And I know that we do have some questions that have come up. So I'll get right into the questions. And if there's any people who have additional questions and you haven't put it in the Q&A or chat yet, I'd encourage you to do so. So let me go to the first set of questions we have. And okay. So in the Q&A, we have a quick question. If someone on the panel can elaborate on the term service resistance in the context of stigma and shame, and how does the term help or hurt the population is referencing. So I can start and then I'll turn it over to our other panelists. So one thing I think is the individuals we encounter sometimes gets labeled as, oh, they're service resistant, they don't want to participate in services. And what we need to remember is that a lot of individuals have had bad experiences, and the individuals that we're encountering have gone through a lot of trauma. So I think we need to be sensitive to that situation, realize that in some cases there are very legitimate reasons why an individual may not want to consider shelter as an option or may not want to connect with a particular service provider. And part of the relationship building that we were talking about earlier is really getting more of that background and also using the times that we connect as an opportunity to kind of share information about changes in our system. Because particularly for individuals who had gone to shelters in the past, what an emergency shelter looks like now is very different than what it looked like 20 years ago when I first started in this field. 20 years ago, the only options we had were really large congregate shelters, whereas many people in a room sleeping on mats on the floor. And today we have a wide range of shelter options, including single room occupancy, some that are more apartment style shelters. So when we engage with people, it's kind of informing people about the changes in the system and also the variety of options available to people. As you remember from that systems flowchart, we do connect people directly to housing from the street, I think, as shared by Heather when she was talking about John's situation, or even the women that Jun encountered. It is possible to engage with people and get them into permanent housing placement. So shelter is not the end goal. That's not where we want to look at as the ultimate destination for someone. But I'm curious if others on the panel want to be able to respond to this question as well. Heather, Jun, or Pua. And Heather, I see you're unmuted.
Yeah, thank you. So I really appreciate this question. One of my folks that know me, I often say that I don't believe that people are resistant to services. I believe that systems are resistant to people. And so the other thing I like to say about this is that when I look at motivational interviewing as a social worker as one of our foundations, and the founder of motivational interviewing, Miller, often says that resistance is not a sign, the client resistance is not a sign that the client is doing anything. It actually means that we as a provider need to shift the way we're doing things. It's actually a sign that we need to change our track, not that the client needs to do anything different. And I realize that that is a kind of a light way to say that, but the reality is, as you mentioned it, Scott, is that trauma and generational trauma is really big here. So I think the piece is, and I actually really heard it from Jun gave a great example, is, well, what do you trying to get into shelter? And then she said, well, I want a playpen. And he's like, okay, well, we can do the playpen, and how about we talk about this? So to me, that's a great example of when we can have the flexibility to meet what we say in harm reduction is any positive change. What is any small thing that that person wants that we can meet that might build a rapport so that then we can have the conversation about that agenda that's both of ours, which might be getting into housing. So I really appreciate when we have the flexibility and privilege of having the time and resources to do that. It's great. I also know that that's not always the reality. So, but being able to, again, look at our own piece of how we're approaching somebody when we see them as resistant is really, I think, part of the solution anyway. Thanks for the opportunity to weigh in.
Thanks, Heather. And Jun, did you want to weigh in?
Just briefly, most of the interactions that I have, I interact with so many people in the same areas quite often. So my conversation, this is legally not a space that you can be in, but What do you want to do? And I'm always going to be here to help connect you and see what I can do to help support that along the way. That's kind of been the role that I've been trying to take. And I'm frustrated with the system and how things work sometimes, but throughout the process, I'm going to try to be kind of an advocate through the way. I know that each of us around this panel and around probably, actually probably everybody that's joined this conference feel the same way. So some of the questions I ask, where do you see yourself in a couple months? How can I help you get there? Is this going to be where you're going to be in a couple months? Because I know some living in the same street, and it's just kind of a day-to-day. I have to survive, but I'm trying to help. Through just brief conversations. I see some people 2 or 3 times a week, and they're coming to me saying, "Hey, Jun, this is what I need. I need an ID. Jun, I don't have healthcare. Can you help me with this? Jun, hey, this is something that can you help me with this? Can you connect me with this person?" So those are my communications back into the system. So yeah, motivational interviews and conversations. I guess that's what it's called, Heather, right?
And then Pua, did you have anything to add as well?
So I just wanted to give one example. We have a person in one of our properties who has said he'll never leave because he really likes it there and he's been there for a long time. But one day he was complaining as he was having to clean up. So I said, well, how much Hawaiian are you? And he said, oh, I'm almost 100%. And I said, well, how come you don't have Hawaiian homelands? And he said, well, I kind of do because my mother was on the list and I inherited her place on the list when she died. And so I followed up and I called Hawaiian Homelands, and sure enough, he is her. I don't know that much about how Hawaiian Homelands works except in the news, but he inherited her place. And so all he needs to do, he's been documented, he qualifies and everything. All he needs to do is get his birth certificate. So that's my goal in life right now, is to get him his birth certificate. And so, but the reason I'm saying that is because technically he's service resistant. He doesn't want any shelter. He doesn't want any help from anybody. He's very friendly and will talk to everybody, but he wants to stay where he is. But if you can find an inn, and for this one, it's Hawaiian Homelands. So he has told me, I will not leave here unless I go into Hawaiian Homelands. So that's an in. We can figure out if we can work on this for him and if we can get him something. You can't jump the Hawaiian Homelands list, of course, but at least it gives us a way to maneuver in. So that's what I try to figure out in my work is even if people don't want this whole list of services or to go to a shelter, what is it that they do want that we can work with them and then see if we can get that.
Thanks, Pua. We have a couple other questions that came in the chat. So another question is, how many people can do or be trained to do what you all do with these case studies? There are many volunteers and staff that could talk with homeless individuals one-on-one, that could help with developing relationships and trust that could translate into positive transitions. And this person clarifies they're not talking about the point in time count kind of volunteer experience, because that's very brief and not the type of interaction needed. So I can take this one and anyone else can chime in. I'd encourage you to connect with the outreach providers in our community. A lot of them have opportunities for volunteers to assist. We have on our homelessness.hawaii.gov website outreach section, and if you go to that, it'll provide the contact information for all of our outreach providers. The other thing is I would encourage you to connect with groups like Partners in Care, which is really a coalition for all of the stakeholders addressing homelessness on Oahu, or bridging the gap on the neighbor islands. So if you need that information, please reach out and we can share that with you. We also started convening bi-weekly outreach and shelter provider calls every other week. And this is a way for both government funded and non-government funded outreach organizations to come together. So if, for example, you're with a church group or another type of community group that does informal outreach, we can loop you into these conversations so that you're able to connect with other providers to be able to partner with them. And then Heather did also put in the chat just now that if anyone wants to partner with Street Outreach in Chinatown to contact her, and that's another opportunity. There's another question that came in, and Pua, this might be best directed to you. This is regarding a recent enforcement action at Sand Island, and asking, and despite offers for help, this is regarding the cleanup at Sand Island, how were interventions and what sort of help were given to the families or individuals prior to the cleanup? So if you can talk briefly about that.
So I'm not sure I understand exactly what the question is, but our process is we go out at least a week before, and we try, and even before that or doing that, have outreach workers go with us so that they can be talking to these people before we actually have to do a cleanup. The actual interventions for Sand Island, if I remember correctly, we were able to connect one person to mental health services. The actual handoff happened after the cleanup. We had a couple of people who wanted to get into specific shelters, but they were not able to get into those specific shelters, and they refused offers for other shelters. So I think the overall success was only the one mental health person. Sand Island, they tend to also decline help. Many of the people at Sand Island have already been kicked out of Halemauliola, and that's how they get to Sand Island. Several of them are already working with case managers, and so they're working on housing. I think there's about 5 people there who are already working on housing. So they normally don't need or don't ask for any additional help. I hope that answers your question.
And I think what we do, just for the person who asked that question, in those kind of situations where someone's already working with someone on housing, is Pua gets that information, and then we actually share it with the outreach or service provider that they're meeting with, so that that person is updated on the individual circumstances. And we, attempt to create, a communications loop. We also do partner with other, like I said, non-traditional outreach providers that operate in that area. So for example, I know IHS partners with Hui Aloha, which is a volunteer group that mobilizes individuals in that Sand Island area as well. And then when we encounter individuals such as the person with severe mental illness that Pua mentioned, we do try to follow up with the Department of Health and other agencies to make sure that they can be reconnected to mental health services if they, fell off. Like I think in the situation she was talking about, the person had been connected to a DOH case manager in June, and then they had lost that connection with that person. So we're trying to rebuild that relationship. So hopefully that answers your question. I know we're just about out of time. There was another question regarding the scope of homelessness on state lands, and I'll really say that ranges depending on the specific location. So I don't think we can give a specific number, but I appreciate all of the interest in the panel. Thank you for the great questions. Thank you everybody for the great work that you do. And if you have any additional questions, please don't hesitate to reach out to us. Our contact information is on the screen. And I'll give you about a minute or so you guys can jump to your next session. Thank you, everybody. Take care.
Thank you, everybody.